Okay.
All right. I'm sitting here at the Volusia International Bible Fellowship in Orange City, Florida. And would you introduce yourself for me, Doctor?
I am Michel Henry Brutus. I am a medical doctor, and I um, I earned a degree in Boston in health management. In '92, I went to Haiti to found Help Incorporated, standing for Health Education Learning Resources Projects.
Now, you mentioned the fact that you were educated in Boston. It's my understanding you have a medical degree from Harvard or
Now, my medical degree, I earned it in from the University of Veracruz in
okay,
Mexico. Then I went to Costa Rica,
okay.
and I came back to Boston, where I studied health management at Harvard University.
Okay. I was introduced to you by Jean-Claude Morin, who's the pastor of Volusia International Bible Fellowship. I want to talk to you a little bit about the organization that you founded called H.E.L.P. It is an organization that, if I'm understanding correctly, is to provide health education and learning to residents and children of Haiti. Is that correct?
Almost correct.
Okay.
Almost. It's an acronym, HELP.
Okay.
Right? It stands for Health, Education, and Learning Resources Projects. The idea behind that name was after I went to Haiti to assess the health needs of Haiti back in 1989. And I came down to the understanding that in order to tackle the health problems in Haiti, we need to start with health education. This is where the name came from, health education. And furthermore, to have adequate health, you need good sanitation, you need uh, good water, drinkable water, you need schooling. So, HELP becomes an integrated project of health, education, primary education, and also water, water, and to better of the environment as well.
Okay. How long has H.E.L.P. been in practice?
We were created
Okay.
in Boston
Okay.
back in 1986,
All right.
and from there we started targeting the Haitian community in Boston as well as the minority groups.
Okay.
I speak both Creole, Haitian Creole, and Spanish very fluently, so I was able to also educate or target the Hispanic community back in Boston. And in 1989, I went to Haiti to assess their health needs. And from there, 92, that was for good.
Okay.
We moved back to Haiti.
Um, we spoke off camera briefly, and I asked you what section of Haiti that you're located in or where you're trying to do things. And you were telling me about water pumps and irrigation projects in a certain part of Haiti, specifically a irrigation system that was severely damaged in the last earthquake. Tell me a little bit about the region in Haiti that you serve and how you serve them and how your organization working with others, whether it's something like Water Missions International or Samaritan's Purse or any of the different organizations. Explain to our viewers and listeners, how can you work with these organizations to provide the relief to Haitians?
Well, first of all, I was enchanted by the idea to even meet Water Mission and also Samaritan Purse. I did hear about these organizations in Haiti. As a matter of fact, without having met the Samaritan Purse
Mm-hmm.
people, I mean, the directors, in a way, we worked together because I provided land to another organization called NET from the DR, from the Dominican Republic, and they were in turn financed by Samaritan Purse. The
Okay.
land I gave for jouissance, usufruct, it's for a number of years,
Mm-hmm.
5 years. So Samaritan first came to the land and put in place some tents,
Mm-hmm.
which were very helpful to the victims of the earthquake. Now, to answer your questions, where we located? Here is located in a in Croix des Bouquets. Croix des Bouquets is a commune that is next to Port-au-Prince,
Okay.
Delma, and we are 30 kilometers east of Port-au-Prince. It takes about 45 minutes to be there. The location, the village where we are at is La Tremblay 5, La Tremblay, which is also known as Vaudreuil.
Okay.
Uh, Once we got to that place, the genesis of help being established there is kind of long. I will spare the time not to go into the historic
Mm-hmm.
of that decision, but it was through my dad, who used to work for a Haitian company, Haitian American company called Hasco. And once I got to Haiti to make the assessment of the health needs, he suggested to me that I should go and see how needy was the population of Vaudreuil. So I took a trip to Vaudreuil, and it was self-evident that there is a lot of poverty. Kids are dying of malnutrition and acute respiratory infections. Mothers are anemic. They have a lot of problems during their pregnancy. So we decided to begin a healthcare program, primary healthcare program, in order to help the kids and the mothers.
Okay.
The population that we serve is around 20,000 people. But people beyond the commune of Croix-des-Bouquets, those communes that are having a frontier with Croix-des-Bouquets, do come and benefit from our services, whether it's in health or in education, in primary school. They do come, and we have our doors open for those who are the most in need of education and health.
You said that you have a website. What's your web address?
It's three W's, www.helpinconline.org.
H.E.L.P.
INC
INC.
ONLINE.org.
.org. Okay. Um, Speaking with Jean Claude, he had mentioned something about you and your organization had or was in the process of having a hospital or pediatric clinic reconstructed.
Yes, indeed. Very quickly, once we were established in Haiti, in Croix-des-Bouquets, matter of fact, in September 1st, 1992, we were able to begin with a dispensary. That we progress into a health, uh, I can say, health unit complete to a hospital structure, providing all the services which is required by a hospital. We name them internal medicine or adult medicine, pediatrics, OBGYN, surgery as well. We parallel to this, we also have what we call an outreach program,
Okay.
and team of doctors and nurses go to the villages to educate the people and also to attend, to give consultations. In 2010, we were able receive to receive close to 300 patients per day coming from Croix-des-Bouquets and beyond Croix-des-Bouquets. With the earthquake, of our six buildings, five collapsed,
Okay.
meaning that we were not able to provide secondary care. But God gave us a mission, and we are going to accomplish what God asked us to do. So, in spite of the collapse of the buildings, we continued to work. So, with one small building that is left, we use it as an outpatient clinic, and the outreach activities has continued. Parallel to it, we have a nutritional center, which is still in existence, where we give a hot meal per day to 250 kids whom attend the school, the primary school. So essentially, we have that capacity of a hospital and the experience after 20 years. At the time, from 1992 until 2010, the land that HELP has was able to harvest, to do agriculture, with which we were giving food, let's say, from our land to the kids.
Mhm.
You name it, vegetables, etc. Beans. We grow tomatoes. We grow sorghum, corn, etc. So that gave us some self-sufficiency, not to depend on other international organizations or even the state. It was an example. Up to now, in spirit, we are an example.
You're currently in the Central Florida area meeting with people because what you want to do is you want to get the medical facilities back up and running. And it's my understanding from Jean-Claude that he mentioned Water Missions International to you because of what the church is doing. If people wanted to get involved with HELP and to assist HELP and work side by side with HELP, one question I told you that I think a lot of people will ask you is who is accountable for financing or the finances and the resources that are put into HELP? Um, you've got a lot of people who are saying, look, there's a lot of money that's been going into Haiti since the earthquake, and yet, or at least, let me rephrase that. They claim that there's a lot of money going into Haiti, and they're seeing very little return for it. You and I spoke about this briefly, and I explained why I have to ask this question because, you know, you have so many celebrities and different people who use tragedies and natural disasters for self-promotion and celebrity. And when you have these different entertainers that have, you know, done these fund drives for Haiti and claim to have raised all this money, but yet none of the money's ever reached Haiti. Is HELP financially transparent? Are you accountable to those who support you and work with you for the finances and the resources that are put into HELP?
Well, to answer to your question, the the answer is yes, we are transparent, and this was the sine qua non condition for us to remain in existence after 20 years. We were able to move forward through our integrity and transparency. Now, you just mentioned something that is factual. A lot of money went to Haiti after the earthquake, and I can even mention numbers. Over $13 billion went to Haiti. That I know. This is something that I know. Haiti receive Haiti as a country only receive 1.5. This is I'm stating what the government has stated.
Okay, so you're saying that $13 billion did in fact go to Haiti, but the Haitian government is saying that they've only received 1.5 billion. That leaves about $12 billion or so.
Exactly. I am not here to pinpoint
Right.
the international community. They are responsible and accountable for what they have said and how it was spent as well. One fact is, help never received one penny from them, and I should be honest to say there is one organization though, Food for the Poor, that has always helped us with medical supply and also with food ingredients for the kids. They have received medical supply from MedShare, so I am thankful to those two organizations. Aside from that, we believe that in order to rebuild and continue to providing services to our community, we need to show that we are transparent. We need to continue with the same factor that help us reach some kind of success. We have to continue with the same. And therefore, I will remain transparent and honest.
Okay. You are a Christian organization or?
I would say that I myself I have the faith of a Christian. I believe deeply that you can do, if you read at this motto behind you, you can read it.
Go
And
ye therefore and teach all nations.
and we are here for that. We believe that God has given each of us a mission. And as such, I proudly say I am a Christian. And I do my best to share that blessing with my co-workers, my staff, because there is no way out. There is no way you can reach success in life without your belief, without your faith, with God guidance.
What does HELP itself as an organization need, and where would that need be?
We need to rebuild the maternity and the pediatric unit as a first step because it is in response to the major need of the community of 20,000. And with the earthquake, there was a substantial migration toward Quadruple from 20,000 people that we assessed 4 years ago. I must say that right now the population has reached over 35,000. So we need to build as soon as we can the maternity and the pediatric unit. And from there, we will go through uh, surgery, OR, and from OR, internal or adult medicine
Mhm.
as a hospital. Uh, the estimated cost of the maternity is $100,000. The estimated cost for the surgical ward is another 75,000. Of course, with the earthquake, we were also victim of vandalism. People came and looted the
Mhm.
place, taking all the major of our equipment. Now, thanks God, there is an organization called Living Water. There are one of our water pumps, hand pumps, was severely damaged, and Living Water was able to install another hand pump. So that allows the kids to drink potable water. But our irrigation system, which we had to do agriculture, was also severely damaged. And although we have the damaged infrastructure, but still there is a great potential to revamp that infrastructure and continue with the irrigation and maximize the water, drinkable water in Guadalupe.
Medical services provided through HELP, are they provided to the people of Haiti um, free of charge? Are residents charged? What type of process do you go through as far as who is provided medical care and who's not? Or do you refuse medical care to anyone?
We we accept every patient that will come
Okay.
and ask for help, medical care. But we have a policy whereby every person who comes to the hospital has to contribute. Whether you contribute financially, monetarily, or with helping, with cleaning, with because what we want to preserve is the Haitian dignity and the belief that you deserve care and we have to contribute in order. It's like paying tax.
Hmm.
So the minimum, we do charge a symbolic price for everyone to come. So the idea is that yes, there is a cost.
Okay, so, and when you're saying contribute, it could be in the process of volunteering, helping with the clinic. Um,
Yes, they can help. For instance, uh, when a patient comes to help, they are asked an equivalent of $2.
okay,
If they don't have it, they can come to the social worker and say, "We don't have the money, but we can help cleaning today."
okay.
This is how we establish that quid pro quo rapport, because mentally, I would love every Haitian to know that my health care depends on me.
Hmm.
Whatever I do, it depends on my effort. And that has given us some results. We are not caritative per se, but they know that it's a partnership. Once we go, I believe that this, if I can share it with you, Larry, this was the key to our success in Quadebouquet. Once we got to Quadebouquet, we sat down with the people and we didn't tell them, you are so poor, we came to help. We said, we came here to help you and we came for you to help us. Understanding the different taboos that you have, all your needs, and let's together synergize and see how we can better off your health, your education. And that has given them the sense of companionship, of partnership.
Okay, so would you say that your organization and its medical services program in Haiti is one that is meant to build a sustainable healthcare system for the residents through education, through participation, through activity action, as opposed to just simply coming in when you're sick and ready to drop over?
It's well put. This is
Okay.
what I'm going to use next time when I'm selling help. Exactly. That's the idea.
So it's
To self-sustain, which is a process, of course. We've been there for 20 years. We have not yet reached total self-sufficiency, but we are on the road to that. If we are at 30% after the earthquake, we took a step back, but we are aiming at that. So the population that receive the services knows that we are in that process. And that is only possible with the participation of every actor. The beneficiaries are also actors. So we have to sensitize them too. Not only our staff, but they have to be sensitized. So all of us who can create that symbiotic relationship and reach there. Even for agriculture, we face a lot of challenges, and mostly after the earthquake, because we don't have a water pump to irrigate water. It has been a big hurdle for the community to continue with agriculture.
mm, when you're talking about the agriculture, food that's produced on this land, how is it distributed?
We one part, it goes as a security valve to our nutritional center. So all the 250 kids that go to our school, our primary school, receive food and they can eat at least vegetables and corn and beans. And another part is giving back to the farmers. And the third part goes to the market, open market, and see if we can generate some fundings from that, which will be again invested into our school or the clinic.
Okay, so the product, you're telling me that the agricultural product basically serves to provide food and nutrition for the program itself, and anything that's sold is actually sold for the benefit of putting money back in and sustaining the organization.
And a third part goes to the farmers,
Right.
the ones that really help. Uh, I have an agreement with the farmers. They come, they grow, they clean the land, and we harvest. But they continue on using the land. I don't charge them to use the land. If at a given time help is not undertaken some agricultural project, they can come and say, we individually, we want to grow some any product. And they will be allowed to only pay for gas to use the water pump, the
Mhm.
irrigation pump. In the land, they can use it as long as they are going to do something positive. They are not asked to return anything to help, but usually because they understand the philosophy behind the partnership, they will bring part of the products to help. And that really gives me a good sense of pride and to see that our education process is taking place.
Does help, actually, let me ask it this way. Where do you personally live? Do you live in Haiti or do you live here in the States or do you live in both?
Now, I would say I live in Haiti. I took the decision. It was imperative for me to take a major decision in my life. And as I shared with Pastor Jean Claude Morin on Sunday, it was a call from God. I was in Boston. I went to Haiti, and then And Dr. Jones, my mentor, Dr. Editor Obi Jones, who is my mentor from Texas, she asked me what I was going to do for Haiti. And I told her, I want to help. I didn't know how. And God inspired me to go. And I decided since then, I went through the embargo time from 92 until 95. I stayed and hey, I am going because this is what God wants. If God wants me to go in Africa, somewhere else, He will show me the way and I will. So the answer is I live in Haiti. I will continue. Without dedicated people, and we have to work as a team, whatever success help had reached, it wasn't the fruit of one person,
Hmm.
myself. It was the fruit of a team of people who espouse the same concept, the same philosophy.
Okay. You mentioned that you were impressed with hearing about Water Missions International through Jean Claude. Um, when we finish this interview, I will uh, give you access, if Jean Claude hasn't already, as far as how to contact the organization. I mean, look, my purpose with working with Jean Claude is to try to bring Water Missions International to as many people that are interested in actively, working with them for sustainable water and sustainable sanitation systems. Um, I've had the opportunity to speak with the founders at great length, and I find them to be extremely genuine and sincere. And these are two people who put their own money and their own company into founding this organization, and they continue to work in it 12 years later, and they take not one penny of pay. So the reason I was asking you these questions is I think people want an understanding of how certain operations in Haiti actually work. Does it benefit the individuals that you're teaching and you're providing services, and how? And I think you've done a good job at explaining that rather than just going in and saying, okay, here, I'm here to take care of you, you're actually bringing citizens of Haiti into the process and teaching them how to sustain this and to care for themselves. So who knows, there's always a door that can be knocked on, and how far it opens depends on how sincere and how genuine and how serious people on both sides of it are. And I think you can be successful. If people wanted to contact you, how do they go about doing that?
Well, they can contact me through my email address, which is mhbrutus85 at hotmail.com.
Okay.
M for Michel, H for Henry, and Brutus, Brutus 85 at hotmail.com. Once they go to our website, which is www.helpenconline.org, there will be an indicator that shows the contact addresses,
Okay.
and our board can be contacted. I'm not the only uh, responsible. There are other people who are responsible as well. But I wanted to mention something about Water Mission. I've heard about Water Mission, and I believe that the work that Water Mission is doing in Haiti and other developing countries, it's a commendable work. And whenever a project is laudable, I am keen to collaborate with such a project. What came up to my mind, if Water Mission were able to come to Quadruple, I will be more than willing to be a, a partner. You see, when you are winning as a team, you don't change the team members. And I think the people who benefit from the services that H.E.L.P provides will understand that concept. If every organization comes to Vaudreuil, to Croix des Bouquets, to provide uh, drinkable water, good treated water, the community will respond by understanding there is a need to collaborate because they know this is the path to success. That will benefit them. They will take pride and dignity into that. And Water Mission will be happy to see that they are helping people who want to self sustain in the future themselves. So water mission will already be welcome. I, as a potential partner, uh, God has blessed me, I must say, through my dad, that I own a lot of land
Mhm.
in Kuala Lumpur. And we have already an irrigation system. Therefore, it will be easier for water mission to first find space to stay. Second, some kind of infrastructure which needs to be repaired, and that should not take a long time. And the community that is going to be the third partner, the community is already prepared
Mhm.
for every kind of new activity.
You mentioned your board members. How many people sit on the board?
Seven
And where is the board centralized? Where are they located?
in New York,
In New York.
right?
Okay. Have you and your organization ever been rated or audited by Charity Navigator or any of the charity?
Those names, no, but we have over the years been partners of international organizations such as Plan International.
Okay.
They have every every 3 months audited the funds that we have received from them. And these, I'm talking about 17 years period from 92 until the earthquake.
Okay.
So they are our reference. And those people who come and audit are not from Haiti. They come from abroad.
Right.
And they come and we have all the report. And from the beginning, I knew that we needed to be transparent, honest, integral in order to continue the partnership in terms of trust.
I want to thank you for being understanding of me continuing to ask these questions,
Right.
because the one thing that I myself and Sinclair News has uh, insisted that we do is I firmly believe that HIT, and it's another acronym, and it stands for honesty, integrity, and transparency. Uh, and excuse me, and in this day and age, whether it be media or whatever, we seem to have a lack of it. So I definitely want to make sure I cover those issues with everybody. So don't take that personal.
No, I do not. As a matter of fact, it's not a coincidence. My principle, my philosophy fall into inadequation with hate
Hmm.
without knowing that you were part of hate. And I just mentioned we believe in honesty, we believe in transparency and integrity.
Okay.
And this is us, help. This is me.
HelpInconline.org, HELPINCONLINE.org. People can go and check it out. They can get more information on you. Those people who are viewing and listening to this interview who want to find more information on Water Missions International can go to watermissions, that is with an S plural.org. And I'll put this up. People will be able to see it. People will be able to listen to it.
Thank you so much.
You know,
Thank you.
the introductions are made. I
Thank you
can
so
tell
much.
you that as far as introducing you to water missions, Jean-Claude is determined to do that, and I
No,
will assist him in any way I can. Is there anything else you want to tell people about your organization that you feel they need to know in order to have a better understanding of who you are and what it is you're trying to accomplish?
I want to say that the community has benefited from our help, our services for 20 years. With the earthquake, we had to take a step back. In spirit, we continue on believing that we have a mission, which is to improve the quality of life of those who are underserved. But the circumstances made it in such a way that right now we have a lot of challenges to face. Among them, to build or rebuild our maternity, to rebuild our child health center, and go on. For now, we are knocking on doors, and I know God is going to provide to help us because we are helping us. We are looking for the next 6 months for $100,000, and after that, we will move to for the surgical ward for another 75,000, And the school, we have a school which was built by USAID 3 years ago, 2 years ago. That school needs to be expanded. And for the expansion, we need another $80,000 because the primary school is saturated with 250. We have to think about the future of those kids, another 250 kids.
So the 100,000 that you're referring to in the next 6 months is for the pediatric unit or the hospital itself?
The maternity and pediatric unit.
Okay.
The hospital is a macro complex. It entails pediatric surgery, adult medicine, etc. We will begin with phases.
Okay.
Phase one is to build the maternity and the pediatric unit.
So you're rebuilding 5 buildings out of 6 that were totally collapsed.
We are rebuilding for now, yes, in the long term.
Right.
But we want to, in the short term, we want to rebuild 2 buildings. They will not be as big as they used to be. We are realistic. There will be anti-seismic constructions. And right now we have something close to $10,000 that we have raised, and we are looking for another 90,000 in order to start as soon as we can.
Okay. Well, Dr. Michel Henry,
Thank you.
I have to be careful with pronouncing names
No,
right now.
you're doing well. You're
Okay.
doing well.
It's been a pleasure talking to you. I wish you all the luck in the world, and you know, let's see where this goes. And let me rephrase that. I wish you all the success in the world,
Thank you.
because sometimes success is based on blessing more than it is on luck.
Indeed, indeed. It was an honor for me to be here and share with the audience and with you the many steps that we have taken and what we have accomplished so far. But I think in the heart of all this is God, who has a mission for each of us on earth and wants us to go and tell all the nations what we are doing. And please tell what a mission that they have in Haiti, a friend, which is H.E.L.P, and we are already willing to facilitate their arrival in Guadeloupe with land and with our structure that we have, the irrigation system that we already have.
Well, actually, I'll do better than that. I think your interview will tell them that, because they'll
Okay.
see it.
All right.
All
It's a
right.
pleasure. I was equally pleased, Larry.
Thank you,
Thanks a lot.
sir.
Thank you, and so long.